I'm starting my ATP Live. All right. Good evening, everyone, and welcome to ATP Live Monday. It's been a while I've been here. All right. Good evening. Welcome. Whichever platform you're watching, on Facebook, on YouTube, on our Instagram, you're welcome. And for those who are new, welcome to ATP Live Monday. This program is brought to you by Atp Pediatrician's Foundation. We are a charity in Nigeria committed to the health and welfare of all children globally, especially in sub-Saharan Africa. And we do that through all these programs, online and offline. So ATP Live is one of our programs where you get to ask any questions that you may have about the health of your children, and we try to answer them in 1 hour. All right, so welcome. Feel free to drop your questions. I'm just going to try and share the video myself, and then we'll start to answer your questions. So thank you so much for joining me wherever you're joining from right now. So I'm just going to try and share the video first, and then we will get to start. But while I'm doing that, I also encourage you to share the video, invite your friends, invite family, anyone that you know has children and will benefit from this program. You can invite them to join us, and I'm also going to do the same. So I'm trying to share the videos on my platform. If you're watching on the page, you can just drop your questions directly. But if you're watching on any of the Facebook groups, remember that you have to click on the video so that you can we can see your questions. Otherwise, if you're just listening in, you can just listen on the platform, on the groups. But if you want to ask questions, remember to click on the video directly, and then you'll be able to post your questions and we can see them. So thank you so much. Welcome everyone. Okay, I guess I've done all the sharing, and now let's do all the pinning. All right. So how has your week been? It's a new week. It's a new day. How has your day been? Lovely, I hope. Monday is always a busy day for most people who are resuming work. All right, so I'm just trying to pin the videos, then we can start. But feel free to start asking the questions in the comments, and I'll start to answer them. All right, okay. Just pinning the videos. Okay, I think I'm done with all the pinnings, all the sharing. All right. Welcome once again. Those who are watching on Instagram. I hope Instagram people can see me. Yeah. Okay. Yes, I can see you now. Welcome. And for those on Facebook and YouTube, feel free. You're welcome to ATP Live Monday. So if you have any question about the health of your children, you can start to ask your questions now. Try to start with the age of the child. Pediatricians, we have a huge spectrum of our constituent members, so from 0 to 18 years. So try and let us know the age, because that will help us in terms of answering the questions. And then also keep the question, give only relevant information and keep the question straight and to the point. Otherwise, Facebook will cut off your your comments and we will not see the rest of it. All right, so I think I have one question already from Sami Obimba. Good evening. My baby is 8 months. I breastfeed my baby exclusively for 6 months. Well done. That's amazing. And up to now, she's 8 months. She doesn't want to eat both cereal and homemade food. So, all right. Thank you, Sami. This is a very popular very common question that we get as pediatricians, children not wanting to eat. And you say you've tried all the formats. I'm not quite sure what the formats you've tried. And she's your fourth and the last baby, so this is not something you're used to. Okay, I can imagine how frustrating that could be. Of course, children are different, so there are some babies you throw anything to them, they just catch it and they will eat it. However, some babies could be a little bit more fussy, and those are the ones that tend to give parents a lot of difficulties, and especially and sometimes, of course, for someone like you, who is a very experienced mother and who has not had this before, I can imagine how frustrating that can be for you. However, I'm not quite sure what format you tried, but from obviously the way you sound, I think you know quite a lot, being a mother of four children already. But the only thing I would just recommend is a little bit of patience, especially when you are introducing new food to children. Sometimes I think we tend to give up quickly, so we give the food once or twice, and the child doesn't take it, and then we assume, I mean, that means they don't want that food, and we quickly rush to try something else. And so if we are doing that, sometimes you need to be a little bit more patient. We usually recommend trying one new food for up to a week. 1 week. In fact, people say 13 times. You need to have offered that same food over and over again, up to 13 times, before you can say that the child is rejecting that one, and before you move on to the next one. Okay. And also another thing I would like to say, that we also need to be sure that the food we are giving is not bland, because I know some mothers so believe, oh, you should not add sugar, you should not add salt, all those things to baby's food. That is actually not correct. Nobody ever said that. What we always recommend is moderation. We don't want you to overload children, and usually you tend to get the overloading of sugar and salt from processed fruit foods, especially canned food, because they have to put all those things to preserve the products. But if you cook food in your own kitchen, you can add a little bit of salt. It has to have taste, okay? And sometimes mothers tend to believe there are some what we call baby food. There is no baby food. Food is food. In other words, some people want to give children so-called cereals, all those canned cereals and all that. Whereas I've seen mothers ask me that, "Oh, maybe I actually prefer the food I eat," and I'm like, that's exactly what you should be giving your baby. What you eat yourself. So sometimes, if you are just been trying only the canned cereals or all those kind of cereals, give the baby the normal food, the same food you hate. Some babies actually prefer that. So those are the additional tips I'm just going to add, because if you say you are experienced mom, I guess like you said, you tried all the formats. But just to be sure, if you have, I don't know whether you've watched our complementary feeding videos. They're available on our Facebook page here. They're also available on our groups. And then if you go to the guide section, we have a group on complement. We have what we call the guides, and there's a guide too that was on complementary feeding, and there are short videos, usually most of them about 5-10 minutes, not more than 10 minutes long, that talk about each aspect of complementary feeding. So I would just request that you watch them, because I'm not sure whether you've tried some of the things we said in those videos. So if you watch those videos and there are things you've done, then the only other thing remaining is just be patient, keep breastfeeding the child. The child's at this age, 6 to 8 months, 80% of the food is still breast milk anyway, because they only need like 2 meals of complementary feeding. That's another thing I forgot to mention. Sometimes when mothers say children don't eat, what they actually meant is that they don't eat as much as you expect them to eat. Not that they don't eat at all, because maybe you expect them to take the same volume of milk as cereals, right? Or solid. No, actually, the quantities of solid they need is actually smaller, because solid is dense and has more calories per that small volume compared to liquid milk. So if your child is taking 1 or 2 spoons, that doesn't mean the child is not eating. So persist. So maybe the next time child will take 3, and then they'll go to take 4. So let's not just assume that they must finish like 100 or 200 meals of food at each sitting. So that's another thing, because I noticed a lot of mothers will say my child is not eating, but what they actually meant is that the child is not taking or finishing the plates what they expect them to finish. So you also have to make sure you're giving the quantity that is age appropriate and not more than that. So I hope I've been able to uh explain that. So yeah, but there is no other solution, there is no magic with children who are not eating. You understand, there's no other magic we're going to do. We're still going to give them food. There are no drugs. If that's maybe you're expecting, maybe there's something we're going to prescribe that will magically make the child to start eating, because I know that's what mothers want us to do. But the honest truth is that there is nothing like that. We don't have anything magical to prescribe. And so mothers always ask me, what can I give my child who is not eating so that the child can eat? And I always answer food. And sometimes mothers think, you are being sarcastic, but that is actually the truth. There is nothing else you're going to give the child who is not eating but food. It's still food you're going to give. There's no drug, there's nothing. It's still food. It's just that you have to be more patient. You have to try and give them in the presentation and the way you the quantity. You can decide to give smaller and more frequently and things like that, but it's still going to be food. And if you've tried all that and you need more like specialist inputs, then you can see a dietitian. The dietitians are they can also maybe guide you more. Sometimes they can also give some nutritional supplements to add to whatever you are giving, at least just to make sure that the child is not losing weight and all that. So but so if you've tried all that and everything I've said now is not really like there are things you've done already, then I'll recommend you see a pediatric dietitian or nutritionist, and then they can take it up and give you additional support around that. I hope that's helpful. Okay, I'll move on to the next question, but let me quickly check Instagram, people. Okay, there's no question yet on Instagram. I hope I'm on the right Instagram page. Yes, okay, I am. All right. The next question I have is from Hope. Hope, how are you? Been a while. You said you gave birth to your baby 2.5 kilos, and at 9 months was 7.5. I'm sure I think we've asked this question before. If I remember correctly. And okay, your baby is losing weight. At 10 months, he has reduced to 6.9. Actually, that is a red flag. We don't want children losing weight. I mean, even remaining on the same weight will also be an amber flag. But when a child is now losing weight, that is a red flag. Okay, at 10 months or your baby should weigh 9.5 kilos, so we don't want the child to be losing weight. So a child has gone from 7.5 to 6.9, that is a red alert, and that child has to see a pediatrician. Okay, the boy doesn't like sucking during the afternoon except he's sleeping. If you bring his food immediately, it seems it will start coughing and it will not take more. I think you really need to see a pediatrician. Number one, it's not just that your child is not eating, is coughing with food. The child is actually losing weight. So once the child starts losing weight, we are really, really worried. And even though the weight right now is already getting to what we call borderline underweight, but the fact that the child has lost weight is going to make us worry so much. And so you definitely need to take the child to see a pediatrician. We need to see the child. We need to look at what you're doing in terms of the feeding. At 10 months, breast milk is not even the main food for a 10-month-old. The child should be eating, and of course, you should still be breastfeeding, but we're not expecting the child to be getting much from breast milk compared to solid. So a 10-month-old, we want them to be eating at least 3 times a day, and then with breastfeeding and maybe 1 or 2 snacks. So the fact that your child is losing weight is giving us sign that this child is not getting enough nutrition, and that's what results, because once children start to lose weight, then they are at risk of so many other issues. So malnutrition is a big issue for us as pediatricians. We don't want children losing weight. So once they start losing weight, then they are at risk of so many other problems. So this is why when anytime we come to the hospital, we always weigh the children. We want to always know their weight, because we know that when the children have at least good weights, the immunity is better. They're able to fight most of these illnesses on their own. But when they start losing weight, then even a minor infection, that even like ordinary malaria that most children will have, and they will recover, for a child who is already malnourished, a child who is already lost some weight, they can actually have very severe illness from things that normally should not have caused so much problem. So we really, really worry about a child who is losing weight. And if the health professional who saw your child at the health center and did that weight and noticed that that child has dropped weight, should have referred you straight away to the doctors, or the doctor should have referred you to the pediatrician. You must see one immediately. It is quite urgent. So I'm not sure which part of the country you are, but I really, really want you to go see a pediatrician. Okay. You said it's not sick. Yeah, well, I understand what you mean by sickness. For you, a sickness means a child is maybe having fever, coughing, and all that. But for us, a child who is losing weight, in a way, is sick. That child is not gaining weight. That child is losing weight. That child is underweight. That child is malnourished. That is actually something more serious for us. So it is. We don't wait until children start having, like, they are now lying down completely, and we have to start admitting them to the hospital before we start talking about weight. Because we start talking about them being sick. So a child who is losing weight is already telling us something is not going on well here. And this is the time for us to intervene. This is the time to quickly intervene, reverse it. We don't ever want to wait until the child is now really ill. That time may be too late for us to do something. So this is the time for us to actually intervene and quickly reverse it. So I still want to maintain that you need to see a pediatrician, and so that they can assess your baby properly, and then they will take it up from there. Those on Instagram, you're welcome. Please, if you have any question, feel free to drop your questions in the comment section, and then I will answer them. All right. So hope, try and see the pediatrician as soon as you can. Some Obimba. Okay, you are updating us that even when on exclusive, she hardly concentrates to suck. I have to pour in a drugs cup to force feed, but no, you shouldn't be force feeding. So, did you try to see a pediatrician all the time that your child was not sucking well? You know, so if a child is struggling to feed, they are not sucking, we want you to come and see us, because we need to know, is there something, is there a reason why this child doesn't want to suck? In fact, I would be more worried about a child who is not sucking compared to a child who is actually just not taking complementary food. So a child who is, at that time that your child is not wanting to suck and all that, that is also a time that we want to worry. Like, is there something underlying medical issue? Because there are medical conditions that will make children not want to suck, what we call poor suck, and that can give us an idea there's something else going on. And what is the weight of this baby? Sonny, you've not told us the weight of your child. You only told us the age. But let me go up and see whether you told us. Yeah, you only told us the age. Can you tell us what is the weight of your child? The last time you weighed the child, what was the birth weight, and what was the weight at the last time? Even if it was your last immunization, just tell us the weight, because the weight is also very crucial for us to know whether the child is getting enough. But if you ever had issues with your child sucking, feeding, you must come and see the pediatrician. Food is so important. Growth and development are the two key features in children that adults don't have. Children must grow and children must develop. They must acquire skills and all that. So if any of them is being affected, and food is very crucial to that growth, the child increasing in weight, increasing in size, if any of those is affected, we really want to see that child. We really, really want to see the child, and so that we can address the issue on time. I hope so. If you're still listening, Somi, can you just let us know what's the weight of the child, at birth and the current weight, or any other weights that you have over the years, over the months, so that we can take it up and at least have an idea where we are right now. Sorry, I know it's frustrating, but we just have to do our best. I mean, the worst that can happen is that we have to put in a tube to feed the child, but that will be the last thing we will do because that's operation, that's invasive, there's so many things involved. All right, Chinaya said, went for 9 months immunization. My baby weighed 10.3, birth weight is 3.5. Oh, that's good. The weight is fine. I don't know whether your question is whether the weight is okay or not. If you are asking whether the weight is okay or not, the weight is absolutely lovely. We want a 9 month old to weigh 9 kilos. Your baby is already weighing a little bit above at 10 kilos, but it's not too much. We're not worried about it. Everything is a range, everything is an average. Average is 9 kilos. Some people weigh a little bit below, a little bit above 10 kilos. We're still not worried about it. So keep doing whatever you're doing. So when you give information, always ask your question, so that I don't want to always assume what you want to ask me. But I think this one is straightforward. So I guess I can assume you want to ask me whether the weight is okay or not. So if it's about the weight being okay or not, so the weight is okay. All right. Ifama, hello, a long time. Okay, I would like to know the correct dosage of paracetamol for 3-year-old. Okay, that is weighing 14 kilos. Paracetamol dose for 1-year-old weighing 10 kilos. Okay. So we pediatricians, we calculate our weight according to we calculate our dose, according to the weight of the child. So that is the weight pediatricians calculate weight, the dosage of medication. For paracetamol is 15 milligram per kilo. So let me see if I can calculate it. Use my calculators here. This is we try to save our brain for other things important. So your first baby is weighing what did you say? The baby 30 the 3-year-old is weighing 14 kilos, which is actually a good weight. So that's 210 milligram. So most paracetamol comes as 120 milligram in 2 meals. In 5 meals, 120 milligram in 5 meals. So 5 meals is 120 milligram, and your child is 210. So let's see how much of that. So it's actually going to be closer to, if you remove 120 from the 210, it's actually going to be closer to so that means your child should be taking like about 7.5 mils of paracetamol. Go 5 minutes 120, and after that you have 90, 40 milligram is what is in 1 meal. So your child should just be taking about 7 meals. I would just go 7 meals, just a little bit above it, but 7 meals should be fine. And for your 1-year-old who is weighing 10 kilos, that one is taking about 5, maybe 5.5 or 6 meals. Sometimes we just give the nearest old figure because it's always difficult for you to get all these small point something, so you can always give the nearest figure. So for the 1-year-old, you can actually just give 5 meals. To be honest, it's still okay. But for your 14 kg child, you can give 7 meals as well. So that's fine. And you can repeat your paracetamol every 6 hours. So you can repeat paracetamol every 6 hours, but not more than 2 days. That is why when you listen to the adverts of paracetamol, they always tell you that if symptoms persist after 2 days. I think some mothers don't know why we always put that there in the adverts. People just think it's just something people like to say. It's actually important because I think somebody was asking us a question over the weekend and was saying, "Oh, if my can I just be giving paracetamol anyhow to my child?" Not she didn't say anyhow, but there's a way she put it, like, "Can you just give paracetamol at any time to the child?" And I have to quickly correct that. No, you can't just keep giving children paracetamol. You can only give paracetamol if the child is having fever. You can give paracetamol if the child is having pain. So those are the only 2 times you're allowed to give paracetamol, and you don't give it for more than 2 days at once. So if after 2 days the symptoms has not gone, that is you doing it now. So not like the doctor has recommended you give paracetamol for 4 days. No, but if you are just your child is having a symptom, either fever or pain, and you give paracetamol, you can repeat it every 6 hours. And after 2 days of giving the paracetamol, if the child is still having those symptoms of either fever or the pain, you should see a doctor. Don't just keep giving paracetamol. And I see a lot of people who say, "Oh, my child is teething," and they just give paracetamol. And I think, "Oh, this child must be tired. I give paracetamol." No, please don't. Even though it's a drug that you can buy over the counter, even though it's a drug that you can give without a doctor's prescription, too much paracetamol can damage the liver of your child. It can damage the liver. It's a what we call a hepatotoxic medication. So overdose of paracetamol would damage the liver of the child. So please don't just be loading children with paracetamol unnecessarily. I see mothers who just think, "Oh, I think the child was being in body pain." No, don't just be giving them paracetamol anyhow. And so repeat your paracetamol every 6 hours if the child is still having fever, if the child is still in pain. But after 2 days, please stop and see a pediatrician so that we will know what is wrong and we can deal with the underlying cause rather than just pumping each other with paracetamol or causing liver damage. So let's just be careful, because I know that people think, "Oh, it's not just paracetamol." No, every drug has side effects, every drug has their complications if you give it unnecessarily. So we allow you to give paracetamol, but no more than 2 days before coming to see us. So I hope if you've cut the doses. So you can give your 3-year-old 7 meals, you can give your 1-year-old 5 meals. That should be fine, averagely. Sonny say, "Oh, she sucked but not so well." Whatever. She was born 3.9, 6 months. She was 9.8. Wow, 9.8. She's overweight. If she's weighing 9.8 at 6 months, that is overweight. Though she was quite big. Um, Mm. So I hope you were not diabetic when you were pregnant. That is number one. Number two, again, that worries me because your child is actually having so much heavy weight, and I'm beginning to wonder when you say your child is not sucking so well. I hope you are not also having too much expectation, of how much the child should be sucking. So usually when children are born, they initially just suck, all the time because their stomach is small. The quantity they need to suck is, they have to take frequent feeds. But as they get bigger, they have bigger tummy, they can keep longer. Much amount of milk in the tummy, so they don't need to be sucking as frequently. And as some mother just think, "Oh, I must feed my baby every 2 hours, I must feed my baby every 3 hours." No, because as children get older, sometimes they are more efficient suckers. So they don't really always need to be sucking one every 2 hours or every 3 hours to get the same amount of milk. And so we go by the weight of the child and not just how long they are staying on the breast. And sometimes it's possible to overfeed children. I would definitely be worried that the child is 6 months old, is weighing 9 kilos. That is actually almost the weight of a 1-year-old child. So I'm not. I would definitely not have been worried about your child's breastfeeding because the child is gaining weight. Well, actually, the child is on the upper limit of the weight scale. So that is that. Then I'm not quite sure of how much your child is eating now, but we also need to know the current weight. And if the child has gained more weight at 8 months, if your child is already more than 10 kilos at 8 months, I'm going to recommend that you just touch base with your pediatrician, because there are conditions that will make children to gain weight rapidly and make them to be very big compared to what is expected for their age. And it may have something to do with food. So there are genetic conditions like Soto syndrome, like Prader-Willi. There are some genetic conditions where children are so big. And even though, like you said, you don't think your child is eating enough, but your child is actually eating the upper limit of the scales. So we need to be sure there's no genetic condition, especially if there's no family history of diabetes or anything like that. So I'll recommend first, let's have the weight of the child again, now that the child is 8 months old, and then see a pediatrician or a dietitian in terms of the feeding part. But maybe the child just needs to regulate their weight as well, because children always eat just what they need. They don't, they should, well, they have their way of knowing what is enough for them, so that they don't take too much. So so I'm not worried about the weight of your child actually, but I just want to be sure there's no other medical issue that could also be making the child to be so big, despite the fact that the child is not eating as much, like you said. All right, let's go on. If I might saying you like to know the correct dosage, I think I've answered that question. All right, I got a question on Instagram. About said they Missy. Good evening, ma'am. My 7-year-old son weighs 20 kilos. Is that not too low? Um, an average 7-year-old should be weighing 24 kilos. 5-year-old will weigh 18, 6-year-old about 20. So by 7 they begin to get to like 24 thereabout. But I won't worry too much about what was the weight of your baby when the child was born, the birth weight, and how much of food is the child eating now. So that's question for Papa said they miss it. So 20 is a little bit on the lower side, but I will not particularly worry so much about it. So in other words, your child is weighing like a 6-year-old, even though he's 7. So it's, and especially if you're on your family side, you are not big people. Some children may be small, but because that is because on the family they usually have small, people, unless you are big and daddy is big, and then okay, maybe we expect the child to be big. So there's some children that are going to be slim and they're smaller, but they're otherwise healthy. So we will not worry so much about their weight. So a 7-year-old having the weight of a 6-year-old is not going to worry me so much, especially if the child is otherwise well, eating well. And we also have to look at the parents, like are they big people in the family or are they smallish people? So, but I'm not worried about it particularly, but we just need to keep an eye on it. The most important thing is that the child is not losing weight further. As long as the child is not losing weight further, um, that's good. Yeah, yeah. Okay. Sonny, so your child was weighing 11 kilos at 7 months. Okay. Birth weight is 3.7. Did you say 3.7? I thought I saw 3.9 before. Let me go back. Yeah, okay. I think you wrote 3.9. Maybe it's a typographical error. Okay, 3.9, 3.7. Just they anything above 4 kilos is big. So she's eating closer to the big side, but it's still okay, it's still within normal. And your child is actually gaining weight too rapidly. I'm worried about that, to be honest. I'm actually more worried now about the weight of the child. Though some actually, if I like what I asked in your family whether you guys are big people and all that. If you are big and so, but otherwise we need to be sure there are no other genetic condition, because this is a child that you said is not eating, but this child is actually overweight. 11 kilos is the weight of an 18-month-old. Just to give you a context, an average 1-year-old weighs 10 kilos, average 2-year-olds weigh 12 kilos. So your child is 7 months and is already having the weight of an 18-month-old by having 11 kilos. So I'm definitely going to be worried a bit about that. There may be no problem, don't get me wrong, but we have to make sure there is none first. We don't just make that assumption. All right, let's move on from the weights and the feeding issues. Olufunsho Oguntade, good evening. I noticed something is always swollen around my son's navel. Okay, and it will go down. Does your child have hernia? That's umbilical hernia. That's the only thing that tends to swell and go down. We call it hernia, and usually it would have been there for a long time. It won't be something new unless something new has happened. So the way you describe it, even though it would be nice to see, but the way you describe it is a typical classic description of umbilical hernia. So something that swell up, actually when the child is coughing or laughing, you say it swell up, and then you can actually press it down and it goes back and it's not painful and all that. So we call it umbilical hernia, but it should be good to see it just to confirm, if possible, to actually touch a pediatrician or any doctor can examine and confirm that your child has umbilical hernia. How old is your child? Always start every question with the weight of the child. child. You didn't tell us, Funsha, the weight of your child. I mean, the age of your child. I always like to know the age because umbilical hernia is very common in black children. Most of the time, if it's not really big and it's not causing any problem, we don't do anything about it because usually by the time our children are getting closer to the age of 5, it kind of resolve on its own. So what is causing umbilical hernia is that there's a space, the place where your baby is connected to you when in the womb. That now we call it the where the placenta attach to the baby, that is the part we cut during delivery. And so that leaves a little bit of hole. There's a little bit of hole in that area, and which you ideally should close. But if it's not fully closed, then things inside the tummy, like the fats around the tummy, what we call the part of the intestine, there's a part of the great intestine, we call them greater omentum and all that. Don't worry about the medical jargon. So they can come out into that hole, into the navel hole, and so it will get big. But because it's just a hole, you can also press them and send them back into. In fact, sometimes the intestine too can come into the holes, and you see it. You see the peristalsis, you see them moving. If you look at it, especially in teen children, you can see it, vibrating there. So it's umbilical hernia. So, but like I said, as children gets bigger, sometimes that space begins to reduce and close, and then you will see it become flat and nothing is swelling up again. But for some children, the hole is so big, so it will not likely close by itself, or it can get complicated with what we call obstruction. Some things can come out and refuse to go back. So we can have what we call obstruction of the hernia. You can even get it strangulated, that blood may not flow to it, and that can lead to emergency operation for what we call acute abdomen. So if it's very big and getting complicated, we will have to do an operation. If it is small and the child is still young, less than 5, we'll give it time and see whether it will resolve. But if it's very big or after the age of 5, some parents are worried about the cosmetic look, your people say only do those kind of things. Some people don't like their children being teased about it. So you can see the pediatric surgeons and they can operate it. Close the hole. It's a very simple operation. They just close the holes and that will be the end of it. So it's something that can be operated very quickly. You do it one day, you go home the same day. You don't have to sleep in the hospital. So if you want to explore it further, just see a pediatrician or a pediatric surgeon to confirm it, and then they can advise whether do we need to treat it or do we need to just leave it. So depending on the age of the child, which you didn't tell us. So that's what will determine that. All right. About said they say your baby was 3.7, not bad. Okay. 3.7 is still normal weight at birth, but 20 kilos at 7 years, also not bad. Ifeoma is asking, my daughter has a lymph node at the back of her hair. After 2 days, she had fever, gave her paracetamol. After that, she hasn't had any fever. Do you need to take her to the hospital? And no, I won't recommend taking her. I would just say just watch. We don't always have, if she's not having fever again, we just leave her alone and watch. We don't have we always live well alone. But if she's still having fever, then yes, you can bring her. Sometimes children just have all these mild viral infections and the body has taken care of it. They don't need the pediatrician to do anything. So you don't need to come and see us. But if she's still having the fever or that swelling, the lymph node is painful when you touch it, or then yes, you can come and see her. But if it's none of those is happening, just watch her for now, and you don't need to do anything. And if she's not having fever again, you don't need to keep giving her the paracetamol if she was the one you were asking about before. All right. Okay. You're asking, is it okay to give sweetened sobo? This sobo issue, I've always asked parents, anything you are not comfortable with, don't bother giving the child. Just give the child things that you are comfortable with. So when you mean sweetening, do you mean that they had a lot of sugar and all that? So the less sugar, the better. Some people say, oh, it's healthy, it's hibiscus flower, blah, blah, blah. I really don't know much in terms of is nutritional content. So I guess we need to ask my nutritionist colleagues. They can tell us more about it, whether it has a lot of vitamin C and all that. So you will need to ask the dietitian about that and do a little more research into that. But any products you are not comfortable, I mean, it's not like it's essential to life, so it's not compulsory to give a child any drink that you have to ask about whether should we give or not give. If it already means you have a doubt about it, then you just leave it out. That's actually the best thing. That's a default position I always recommend for parents. Anything you're not comfortable, you're not sure about, don't even bother giving it. Especially since it's not like it's something that is essential that you have you must give the children. And as much as possible, if some people I know they sweeten it with dates or pineapple, like natural products, that should be fine. But if they have to be pouring sugars or sweeteners, then that may not be as healthy, option. So that's just what I would say. Okay, so now you say your child is 3 years old. So usually it's very unlikely for oblique hernia to start for the first time at the age of 3. So it usually would have been there before now, unless you were not really paying attention to it. So, but usually it's very unlikely for umbilical hernia to start at the age of 3, unless the child has not had an operation. In other words, it wasn't there before, that the child had an operation or something happened, and it's now a secondary hernia to maybe an operation. But if it's something the child never had before, it's very unlikely to start at the age of 3. It usually is always there before now, and I assume you should have been noticing it, unless you were not really paying attention. But like I said, it's always good to just have somebody look at the child and confirm it. But from what you described, that's what I suspect. Okay. All right. Let's move on. Instagram. I think Lorita, good evening. You're welcome. Thank you for joining us. Okay, about said they may say your baby's penis length is about 3 cm when pulled. Did you measure it by yourself? Because you can measure it. We actually have what we use to measure it. So usually the pediatrician have to measure it. So I won't, unless you're a medical personnel, but I won't definitely trust the parents' measurements. I really prefer we do it ourselves. So if you're worried that your baby's penile length is small, you have to see a pediatrician. You have to see preferably the pediatric endocrinologist. Is it the same child that you're worried about the weight? I mean, is it the same boy? No, this one is a 9-year-old. The other one was 7 years old. So it's not the same child. Okay, I figure it out. All right. So if you're worried about the length, you should see us. Though I mean, anything above 2.5, really, we will not worry about it. But I just want to be sure, because you say you've measured 3, but you're also thinking it's small. But remember that your 9-year-old is just about to go into puberty. So you're not definitely going to assume that the penile length should be that of a child who is of an adolescent. So, but I would really be more comfortable if because what we do is what we call stretch penile length. And there's a way the pediatrician measure it. So unless you've been to the hospital and they measure it for you and they've already assured you that it's 3 and it's normal, and then you are just second guessing or double checking with me, that's fine. But if it is you that did it by yourself, I really recommend you see a pediatrician, preferably pediatric endocrine doctors in any of our teaching hospitals, so they can do it properly and then they can advise further. But I would definitely not worry about a 3 cm length. Your child's weight is 37 kilos, it's fine, and it's weight 3.5. Yeah, 37. Yeah, for a 9-year-old, I hope that's not on the high side, but it should be okay. All right. Let me go back to Facebook. All right. Hope you said I didn't answer your question. I've answered your question. No, what is your question? Let me see. The last thing you posted is that your child was not sick, and I already answered that. Yes, being the child, even whether the child is not sick, the fact that the child is losing weight is a concern. Maybe you kind of went offline a bit and you're just back. But I've answered your question, and I just to summarize the answer I gave you, that the fact that your child is losing weight is a red flag for me as a pediatrician, and I really want you to see a pediatrician. No, you can't wait till 11 months. You need to see a pediatrician now. You understand? This child has lost weight. So your child was 7.5 at 9 months. Then at 10 months, it went down to 6 points. Let me go back to your post, the original post. So let's go back to it. Yeah. So this was the original post. So your baby was 2.5, 9 months it was 7.5. Then 10 months it went down to 6.9. That child has lost 600 grams in 1 month. That is a big flag to any pediatrician. So we have for our nurses and our healthcare workers who see children, whenever they see your child, they're supposed to plot the child's weight on a graph. The weight should always be going up. It should always be going up. It should never remain the same on the same line, and it should never go down. So in this scenario now, the weight has not even just remained on the line, it has actually dipped down, it has gone down. That is a red flag. If it remained the same, that would be like amber flag, and then we'll begin to walk about, let's increase food, let's do this, let's recheck it again. But the fact that this child has lost weight is a red flag. So this child must, and I was even saying, I don't know what you maybe you didn't hear when I was saying it, that the people who actually did that weight should must have, because that's are the kind of things they are taught. That's the way we train, to let them know that once you see that a child has deep down on the centers, you must have been referred to the pediatrician straight away. But sometimes I think people don't even pay attention to all these weights, and they don't plot it, so they don't even take note of it. Because the reason why we do all this weight is to compare. It's not just a fancy thing or like something you just do. We are not doing them just to fulfill all righteousness or something nice to do when you come to the hospital. No, we're doing them for reasons, and this is one of the reasons we do them. If a child is losing weight, we must intervene. And like I was trying to say, is that we don't wait until your child is very sick or that we now need to start rehabilitating and running up and down. Now that this child does not appear to be sick but is losing weight, this is a time for us to actually intervene. Okay, this is a time for us to intervene aggressively and make sure that we reverse that weight loss. Make sure the child starts to gain weight again, because an average 10-month-old should be weighing 9.5 kilos. So if your child is not even getting it up to 9 and 9.5, which is what we're expecting, and now the child has even now gone below what it was before, that is a red flag. And this is a time for you to see a pediatrician immediately, and it is urgent. So I hope you just let me know you've got the answer now, because it must be fixed. It's something that has to be done urgently. We can't afford to wait, because, like I was trying to say, for children, weight is so crucial for them, because if children lose weight, then they become more vulnerable. They are more susceptible to every other illness, even what the people will call simple malaria. In a child who is already losing weight or malnourished, that simple malaria will become severe malaria, you know, and any little, and then they are more susceptible to all these what we call opportunistic infections, because our children's immunity is tied strictly to their nutrition. So when children are malnourished, their immune system becomes deficient, and once the immune system is deficient, most of this infection that normally the child would have been able to fight on their own, the child can become very ill with them. So we always want children's weight to be optimum at all times. So once it's dropping, we are aggressively intervening. So I hope you've got the answer now. So please see a pediatrician urgently. Okay, I'm happy that you've gotten my answer now. Yeah, so see a pediatrician. All right, Ifama is asking about the academic capabilities of a 3-year-old Okay, so for a 3-year-old, we don't talk academics in 3-year-olds. I know Nigerian schools. Everybody wants to open schools. Everybody wants children to come to school. But really, for us, 3-year-old children below the age of 6, we call them preschool. Preschoolers. That is how we refer to below 6 years old. So preschoolers, we are not talking academics at all in them. There's nothing academic. What we talk about in children below the age of 5 is development. We are more interested in their development, not in any academic anything. There's nothing academic. They don't even need to be in school. They are supposed to be in preschool. And what they're supposed to be doing in preschool is to play, is to develop interaction with other children, social skills, just their play skills they develop, that's what we want. So I don't want parents to be worried about academics in 3-year-olds and all that. Children should go to school to play with toys, imaginative play, role play. Those are the things we want for 3-year-old. Okay, all these trying to force them to memorize alphabets and numbers and all that, it's not necessary. What I really want to know is that is this child talking? Is this child able to speak? Is this child playing with other children? Is this child able to do imaginative role play with toys appropriately? Those are the things we want to check for in a 3-year-old, not them writing or doing maths or doing this or doing that. Most of those things are just what schools and teachers have kind of push on this trend. Most 3-year-olds should be at home. They should be with their mothers. They should be with their siblings. They should learn to play with them. So, of course, going to preschool maybe for 2-3 hours a day is fine, just for them to go and play, not and learn to interact with other children, and not to go and be doing all these assignments and homeworks and all those things that people are putting on top of children. So we start talking about learning, cognitive, academic stuff after the age of 4, 5. That is even the time we can do such kind of assessment. We don't do it before the age of 5 anyway. So I don't really think you should worry about the child. I think you should focus on your child's development. So we want a 3-year-old in terms of the speech. We want them to be speaking in 3 to 4 word sentences, at least with some 75% clarity. In other words, a stranger should be able to understand 75% of what a 3-year-old is saying. We want 3-year-olds to be able to play and do imaginative role play. So pretending to be a doctor, all these what's the name of this child that does this doctor role play? I've forgotten now. No, those kind of things. Those are the kind of things we want them to be doing at that age. We want them to make friends. So they will tell us the name of their best friend, why they're their best friend. Those are the kind of things we want them to do. We want them to be able to walk and jump and run. For a 3-year-old, we let them to be able to do a circle, copy a circle. We expect them to be able to build cubes of maybe 9 tower high. Those are the kind of things we expect from 3-year-olds. Not doing alphabets or counting numbers, and it's really not necessary. They will get there when they get there, but the foundation, which is the developmental milestones, that is what is crucial at this age. I hope that's helpful. All right. Okay. Seems like some part of your question was cut off, but let me see if I can see it. Yeah, you don't need to put unnecessary expectation on the child. No, it's not necessary. It's not. Some children are very good with, memorizing things, good memory, but doesn't necessarily mean it's something compulsory for them. All right, about let me say, okay, it was mentioned in the hospital. Okay, good. I'm happy because obviously I already suspected it must have been mentioned in the hospital because most mothers don't measure, we don't measure penile length, and it's something doctors do. So I was surprised when you start talking about that. So I knew that it's either you're a medical person or you must have gone to the hospital. I really see mothers talk about stretch penile length. That is doctor's job. Okay, and you already have an appointment with endocrinology. That makes sense. So that's good. Okay, good. Don't worry, don't panic. Just um see your pediatric endocrinologist, and they will reassure you further. If at all they want to do blood tests, hormone profile, they will do all that. But I personally am not worried. If the measurement is 3 and the child is 9, I won't be worried. But I'm happy you already have an appointment coming up. So that's amazing. So that should do. That should do. All right. Okay. So I think I got 5 more minutes. Thank you so much to everybody who has joined us and who have asked questions. If you still have any questions, please feel free to go to our Facebook group, Ask the Pediatrician Facebook. We're there 24 hours, Monday to Saturdays, apart from Sundays. So you can ask your questions anytime. And we'll try our best to answer your questions as soon as we can. Please be patient with us. We expect you to only ask, you know, questions that can wait. Okay. If a child is very sick and very ill, please, you have to go to the hospital. That's where you're going to see the pediatricians. You can see the pediatricians in the hospital, but if a child is well and you're just like some of the questions we have asked today, oh, my child is not eating, or my child's weight is this, what do I do? Otherwise well children, what is the dose of paracetamol, what is this, what is that? Yes, we're happy to answer those questions on our Facebook group. We try to do it most of the time. We answer your question within 24 hours, but if there's a question that is a little bit complicated for the pediatrician, that may take up to 48 hours, depending on our specialists when they come online, because it's a volunteer service. So be patient with us. But if a child is very sick, child is having high fever, child is convulsing, child is bleeding, child is unconscious, please always take sick children to the hospital. All right. April is Autism Awareness Month. I was hoping I'll have a break in between all the questions to talk a little bit about autism, but I didn't have today. But then it's something we talk about every year in April. So most of you are quite familiar with autism. The incidents seem to be rising all over the world. And I think parents are more aware, people are more alert to autism symptoms. And maybe social media, people see a lot of parents with children with autism coming online to talk about their family, talk about their children, tell us what they do. So a lot of people are now familiar with what autism looks like. Just to say that if you think your child may be autistic, please get an assessment done by qualified professionals, especially developmental pediatricians. In Nigeria, we don't always have developmental pediatricians, but we have pediatric neurologists. Some other pediatricians who also have skills can do the assessment. Also, speech therapists, some of them are also trained to do some autism assessment, psychologists as well. Children with autism, with the right support, they can thrive and do well. It's a big spectrum. So we have the children who are nonverbal, who are completely dependent, level 3 need of support. And then we have people who are autistic, but you will never know they're even autistic because they unless they tell you, or just you notice just a little bit of traits in them. So it's a big spectrum. But if your child is not talking by the age of 2, your child is not giving high contact, your child is not playing with other children, the child likes to be on his own, the child is doing a lot of repetitive behavior, the child is very rigid, always want things to be done in a particular way, those are the red flags or signs of autism. And you should take that child for an assessment. For children between the age of 16 months to 31 months, we do have the MChat, which is available online. Just put it into your search engine like Google or any of the search engine and put in MChat. It will bring it back to you. You can fill it online and it will give you a feedback straight away and tell you whether it is normal or whether it's mild risk and you still need to do it again, or whether it's something you need to go see your pediatrician for assessment. So that's just a little bit I will talk about autism. Maybe next week. The whole of April is Autism Awareness Month anyway, so I may be able to do a little bit more awareness around autism in our next edition. So thank you so much everyone for joining me. Keep following us on all our social media platforms, share all our videos. We are here so that people will learn. We are your partner in raising healthy children. So thank you so much and have a wonderful, wonderful rest of your evening and week. And I'll see you again next week, God willing. Um, thank you, and it is bye bye from me. Bye.